Joining us today is Lehtimaki. She is a chiropodist and a nurse with a foot care practice for 28 years. For the last 12, she has owned and operated Sioux Chiropody Clinic as a practicing chiropodist. Welcome, Lori. Thank you for joining us.
Hi, Tara. Thank you for having me.
Absolutely. So, Lori, tell us a bit about yourself and how you became interested in foot care.
I started out with a business called Just Feet in 1992 after I graduated from nursing at Sioux College. And I just saw a need for foot care in the community, and I really wanted to find a niche for myself because I like to be my own boss, and I needed to find something in the caring field that I could still be independent and work. So foot care was something that I noticed there was a need and fell in love with it. So, and then 12 years after that, I'm in my 13th year, I went to chiropody school and became a chiropodist and started back in chiropody practice in 2007, I believe it was. So yeah, so I'm in my 13th year of chiropody.
Amazing. So that's been quite the journey that you've been on. What was the reason that you chose to go back to school for chiropody?
I guess I just saw the need that I needed to increase my depth and breadth of knowledge and be at the top of my game. I got frustrated with, I only could reach a certain level with nursing foot care, and I definitely saw the need that I need to go more. And in our community, there's only 3 of us, and there's lots of room for foot care. I mean, it's until we learn to fly, people are going to have feet, and it's amazing. There's one whole big career wrapped all around it. So it really turned out well for me as far as choosing my path and my career walking down this path, so to speak.
That's amazing. It sounds like you are a lifelong learner.
Yes, I'm very resilient. I you can get bored easy and continue educating yourself, right? It's never too late to go back to school and do better things for yourself.
Absolutely. I think that's amazing. So can you define for us now, it's been mentioned a few times, what is chiropody?
Okay, a chiropodist is a medical surgical foot specialist. And I'm just going to kind of read the definition because that'll be a little bit better. And the practice of chiropody is the assessment of the foot and the treatment and prevention of diseases, disorders, and dysfunctions of the foot through therapeutic, orthotic, and palliative means. So we're also governed by the Regulated Health Act, and we have we're governed by a college, so you can be protected. So the public's protected with our profession.
And can you tell us a bit more about the range of foot concerns that you deal with? Because you mentioned medical surgical professionals, so I'd like to hear more about the range there.
Okay, well, chiropodists, we start with a very detailed medical history and assessment, of course, and typically what we see are ailments. So I call it the complaints department. People typically come into our place with a definite problem and needs to be addressed really quickly. So things like corns, calluses, ingrown toenails, ankle pain, knee pain, hip pain, foot pain, bunions, hammer toes. So any of these types of things we do. Now surgically, we can do soft tissue surgeries, anything below the ankle, as long as you're trained and competent in those things. So we can give an anesthetic and freeze your toe, and nail procedures, wart treatments, a list of other soft tissue surgeries that we can do that a lot of times we just don't do. So it depends on, we can do tendon releases, we can do neuroma removals, but if you're competent for these things, then you can do them. So the difference between an American podiatrist and a Canadian chiropodist is American podiatrists learn to do forefoot bone surgery. So they're allowed the forefoot of the foot, they can do, bunions and hammer toes and things like that.
Okay, thank you for the clarification. So you mentioned a little bit about some treatment options that you offer in terms of your scope of practice. Can you tell us a little bit more?
Treatments that we offer?
Yes.
Okay. Well, typically what I do all day long is take care of ingrown toenails. I do biomechanical assessments and gait analysis to determine a lot of the different aches and pains in the body. So Gait analysis is a study of how people walk. So I watch you walk. We take measurements. We want to know how much range of motion is going on in different joints. We look for symmetry, all those things that can cause knee replacements, hip replacements, degenerative diseases like osteoarthritis. So I always say until we learn to fly, we hit the ground with our heel in the morning. So therefore, it dictates everything that we do. So typically, that's one of my passions is biomechanics, and I help a lot of people take away a lot of different pains in a very easy, conservative fashion. So we try to shoot for non-surgical procedures as far as mechanics go. So referring to, say, an orthopedic surgeon for a bunion surgery. Well, we want to find out what's going on with the bunions and why they're coming, rather than just jumping into say, oh, you need surgery on your bunions because you have pain. Well, there's a reason that bunion is there, and so I need to just figure out what the primary problem is, and that's what we do.
Awesome. You are very much speaking my language with getting to the root cause of what's going on so you can figure it out, and then you can move forward with treatment, but also be focusing on prevention as well, it sounds like.
Yes, exactly. Prevention is the best thing. I see children as when they start to walk, and right to adults into their 90s. And if you're active and you can move, I can help you.
Awesome. And so if a woman had a foot concern and she was going to be coming to your office, is there anything that she could be doing in advance to prepare herself for when she arrives?
Yes, bring all your footwear. I want to see your footwear. Footwear, fashion and vanity is very important. It's important to me, and it's important to most women. And if you say you're not, you're lying. But your fashion could be running shoes, right? But I say you have to wear the right shoe for the right activity. So I really need to see what your habits are, so I can guide you in the right direction. If you're not going to comply, and if I'm not going to comply to your lifestyle, then there's no way anything is going to work. So we need to work together and look at the footwear first. Footwear is really important. The package we put our feet in can make a big difference in how our overall feeling of how we feel. Never mind orthotics. How about just have a good look at your footwear. Stay away from department stores. Go to better places, and they're out there, right? So
yes,
that's the first thing. Footwear.
I love your approach. It sounds like you really want to work together, have a partnership, because if there's not a realistic treatment plan, it doesn't matter if it's the best treatment plan in the world, does it?
No, it doesn't. If you walk into my office and think I'm just going to try to sell you something, then you're in the wrong place. I'm there I want people that are there because they're serious about their health. They want to get better. They want to look at the long term, so they can walk healthy through life, right? So really, really important to start with some easy basics and work into something more permanent.
And I have a question too, because I know you mentioned one of the best things you could do to prepare for the appointment is to bring in all your footwear. I could just imagine the number of different hints that you pick up on about a woman's health when you are looking at her footwear. What are the kinds of things that you are noticing and finding out?
Well, women have excuses for everything. We're really good at that. So the things I find out when you bring in your footwear, I check wear patterns, first of all. So whether it's just in a running shoe, I take the insole out of the running shoe, I have a look at it. That's a true pattern. You can walk across a gait analysis machine 3 or 4 times. You're not going to get in a true pattern. Insoles in your running shoes that you wear regularly don't lie. The outside wear patterns of casual shoes don't lie. So I look at all those things, and to determine, it's a big part of the biomechanical assessment even before I touch your foot. So it gives me a map of things to look for when you take your shoes and socks off. So it'll show me callus patterns. Typically, a lot of the aches and pains that people are complaining about, I'll go, well, yeah, because look at the pressure rate over here. That muscle's attached to that, and that's why you're having the shin problem. So those are all the things that we have to put together. If people walk in with terrible footwear, then the first thing I do is I tell them that I'm going to tell you everything that's wrong today. I'm going to rip your shoes apart, and you may or may not like me when you leave, but you'll get your money's worth. I guarantee you. And then I get them out shoe shopping. So it's like what not to wear show. I've got the rules. I give you rules for shoe shopping. Shoes are really important, and you should never scrimp on a good set of tires. So don't scrimp on a good set of shoes.
So true. And it sounds like, there's so many things that you are noticing from the footwear. And I agree, like across medicine and even in my own practice, I'm always looking for patterns. What is something that's true over time versus something that's a one-off kind of scenario? So I appreciate that explanation. And I think it's very true across all different healthcare disciplines. Also, I am so curious to know, and I know our viewers would want to know as well, what are Lori's rules for shoe shopping?
Oh, well, first of all, my rule is that everybody should have a set of really good athletic shoe in their wardrobe, and it should be something that you should be wearing 80% of the time. So a running shoe, strong heel counter. You're spending basically, let's put it this way: if you're not spending $150 or more retail on a really good set of running shoes, then you're not getting a good set of tires. So you really have to look at that. Talk to the people that you go shoe shopping with. I give advice on where to go, and to the right people that are going to guide you through, measure your foot, give you all the information on all of those types of footwear. So first thing, you should have that in your wardrobe, whether it's for exercise or just every day, going to the grocery store, that kind of thing. Then when you want to go out for lunch with your girlfriend or have dinner with your husband and you want to wear some fashion, then you're going to do that because you're going to leave from the car and you're going to go into the restaurant, you're going to look your best, and then your feet are going to be under the table. So, again, wearing the right shoe for the right activity is really, really important.
Yeah, and it really helps to have some ground rules. So it sounds like, one, you need to invest, be prepared to invest. Two, get an athletic shoe that's going to be like a foundation, but don't necessarily sacrifice on fashion. Just make sure it's those smaller opportunities where you're wearing really fancy, perhaps uncomfortable shoes.
Yeah, exactly. So every day wear that best structured shoe. That's for sure. Yeah.
Perfect. Thank you so much for sharing. So what are the most common discussions that you have with women, particularly about foot health?
I would have to say, again, it's probably footwear is a big thing. A lot, again, as we get older, all of a sudden, it's, I think footwear, we get into a very, very intimate conversations about footwear and feet. People don't like to show their feet. People are embarrassed about their feet. It's a part of the body they don't like to show. And then when they have to bring in their shoes, it all of a sudden, it's like you're entering a very intimate part of their life. And so we talk a lot about that, and I try to give them advice on how they can enjoy their fashion and vanity. Like, I have 5 pairs of running shoes. Well, 3 of those are very good structured running shoes for what I use them for. And then I have my fashion running shoes that go really cute with my dress, right? Because if I'm going to the grocery store, I'm still wearing my running shoes, but I want to have a little bit of fashion. So it's balancing that in your life, just like you'd balance anything else. And funny enough, it's really important. Shoes are really, really, really important. And when we look down, we want to look, it has to look proper to us, right? So it's guiding people to find those right shoes for the right activities. And you have to compromise. You have to compromise with them because changing those habits, especially when you hit your 40s and up, we're kind of stuck in our ways. We have our fashion sense already set for ourselves, and we pretty much stick to the same thing over and over again. So I try to guide ladies to, like, okay, buy a pair of $300 riding boots, because guess what? You're going to have those for 10 years. So divide that up over 10 years. So I try to do that. And like you say, oh, my husband or my wife doesn't let me, buy footwear. Oh, well, you know what? I'm sending you home with a prescription and you need to go buy. If you're not walking around with, $200 or more on your feet, you don't have a good set of tires. And we just have 2 feet and rather than 4 tires. So, that's the biggest conversation. And I have bunions. My bunions hurt. My hammer toes hurt. I don't want to wear those shoes because they're too wide. They do this, they do that. So it's vanity. Vanity is the biggest conversation.
Yeah. Well, thank you for enlightening us to that. And you may have mentioned this a little bit, but what are some common obstacles that women encounter when they may be struggling with foot pain?
I would have to say, like, probably ingrown toenails, making this, again, that's going to be related to footwear as well. It's also related to mechanics.
Mm-hmm.
Little simple things like corns and calluses. It depends on, if they're working, if they stand all day, if have somebody standing all day, we can get a lot of people coming in with forefoot pain.
Mm-hmm.
There's a lot of pressure that comes down through the foot, so it can impinge nerves
Mm-hmm.
and tendons and things like that. So it's a lot of things. A lot of people that come in and say, I'm fine all day, but in the middle of the night, all of a sudden I got all these cramps in my feet. So I have to try to help them understand how those mechanical issues, and when we're relaxing, can change things, right? Where our body's trying to get back to some kind of normal when it's been overworked all day. So it's a big question, and there could be a lot of answers to that. Yeah.
Sure. Now we've talked a lot about treatment and about some of the issues that arise and a little bit about prevention. What are some simple steps that women could take to prevent foot problems in the first place?
Footwear.
Yes, thank you.
We're gonna go back to footwear again, right? Modifying your activity. If you have something that you're having pain, have a look around you. A lot of times when I come in, somebody will come into the office. Again, we have to put the puzzle together. Well, I have foot pain. I don't know what happened. All of a sudden I just woke up and I have foot pain. Okay, all right. So we'll sit down. I'll say, okay, well, what have you been doing? Well, I haven't been doing anything. Well, we all do something. We get up and we walk. What did you do today? So I start asking, okay, have you been in the garden? Have you gone for a walk? Did you change your shoes? So it's trying to find out the puzzle. And a lot of times it's quite simple. And I will go, oh my gosh, yeah, I was bent over gardening for that all day. No wonder my big toe's sore. I was putting all that pressure there. Okay, well, now we have to get rid of the inflammation, right? So we can do some taping, give some advice on, footwear, icing, there's all those little treatments that we can do. So those are the challenges. Is trying to figure out why is the pain there and where is it coming from, because nobody knows where it came from, right?
Yes.
But once you start asking them questions, they'll go, oh yeah, I went for a hike with my girlfriend. I forgot all about that. I wore a new pair of hiking boots, and now I got to kill my back and my heel's killing me, right? Well, probably you haven't walked for 4 months, all of a sudden it's springtime and you're out doing new activities and new shoes. And then all of a sudden you start to get inflammation and things start to happen. And people don't want to rest, they don't want to rest.
Yes. And I think sometimes too, as a patient, we might not always recognize what might be impacting our foot health. But then once we have an expert guiding us to help open up our mind to all the different possibilities and impacts on our feet, then it starts to really jog your memory, and then you can really recollect and realize what those connections are.
Well, people will say, oh, and I'll look at something on their feet and I'll say, you must be having some low back pain or maybe some hip pain, Yes, I see my chiropractor like once a week. I think, okay, well, we need to work together with your chiropractor and me, and let's have a look at the biomechanics. And then there's a reason why you're seeing that there's something wrong, right? So if our body has to compensate in any way because something about us isn't perfect when we hit the ground, it's going to have a compensatory effect up the body somewhere. It's got to go somewhere. Typically, it hits the center of gravity somewhere, which is our hips, our groin, our low back, those types of things. So we'll get symptoms like iliotibial band syndrome down the side of the leg. You'll get groin pain. You'll get bursitis in the hips. Sciatica. All these things are all related. So it's looking at that. All the other stuff, and all of a sudden people, oh yeah, okay, it makes sense now. I always thought it started at my hip and went down to my leg. Well, you don't have to have a pain in your foot, but your feet can cause you pain other place else, right? So there's always that puzzle. Well, I never had foot pain before. You're lucky, your body's compensated quite well, but it's starting to affect you over here in the left hip where you have that's why you have bursitis. So those types of things we put puzzles together, right, all day long.
Yeah, absolutely. Yeah. Absolutely. What are your thoughts on recommendations for footwear inside the house?
I think it depends on, again, what you're doing in the house. In the house, I have a running shoe. Okay, so I have my treadmill running shoe, which I also use in the house. If I'm doing a lot of work in the house during the week, I'm up and down doing stuff. A good running shoe is really good. Most of us humans are very lazy, and we don't like to tie our shoes. So we want to have something that goes on and off. And be honest, we have timed people putting on 2 shoes. An adult takes about 38 to 42 seconds to put on 2 shoes and tie them. So, and if you can reach them, you should be okay. A clog, sometimes people like around the house, something that's between you and the ground that's going to give you a little bit of cush, like something that your body can adapt to. So when we have hard floors, our feet don't adapt to hard floors. If we're outside, our feet adapt to the grass if we're barefoot. So the shoe has to mimic that space between you and that hard ground to help your body to adapt to the ground we're walking on.
Great. Thank you for your insights there. I think it's important to consider, all the activities we're doing, whether they're inside, outside, particularly where, our feet are involved again. So what could a woman do who is experiencing foot pain right now to improve her well-being?
Go shoe shopping. I'm going to answer that one for everything. For overall well-being is first of all, whether you have pain or not, you should know information about your feet. We know information about the rest of our bodies. We go to the dentist, we go to the eye doctor, we go to our physician, our naturopath, our chiropractors, all these things, and we should, so it's all related, right? So again, you have to come in, understand what's going on with your body so you can make informed decisions, right? So book an appointment and just come in for a chiropody assessment and ask me questions and let's answer them for you.
Mm-hmm. And there's been several conditions that you've mentioned throughout that I just wanted to get some clarification on so our viewers have a better understanding too, because there may be myths out there and we want to definitely dispel myths and speak the truth. So if we're talking about bunions, hammer toes, etc., like, are these conditions that are genetic? Because I know a lot of women say, oh, well, my mother had these, so I have this. Or is this something that is as a result of how we are using our feet and how we're moving in mechanics?
Okay. Well, our head and our feet can work together simultaneously sometimes, but we typically just walk and do what we do unconsciously, right? So hammer toes and bunions are definitely can be linked to hereditary. Okay. So it's all, again, how our heel hits the ground and how everything moves. So if our structure, which is our bone structure, isn't perfect, so some of us have, say, bull-legged or we're knock-kneed, there are different angles and it creates a different compensation act. Typically, it's going to go into anything that we change. If we have to change the way we move because something's not perfect when we stand up, then we're going to get over pull and contractures of muscles, and so some muscles are going to work harder, some are going to be more relaxed because they're trying to balance things. So hereditary, yeah, typically when we hit the ground, that's what's the hereditary part and how the body compensates for that problem when you hit the ground. So yes, definitely linked to hereditary. So if grandma has bunions or hammer toes, and you're starting to get them, you can prevent that with really good shoes and orthotics. We can definitely help stop that from carrying on. But yeah, hereditary, big time.
Yes, thank you. Yeah, because I know so often that there's that lack of clarity and sometimes it can make us feel powerless if, well, there's nothing we can do about it. It's just something that I've inherited and therefore I am, destined to suffer this. But if there is still something we can do in spite of our heredity, I think that is a really important place of power for women to come from.
I'm going to throw something else in there too, is that those types of things, hammer toes and bunions, they can be easily prevented with an orthotic. But if you get surgery on those hammer toes and bunions by a surgeon, well, guess what? When your heel hits the ground, it still wants to do that compensatory action that it's going to do. It's not going to change. That's what we're born with. No, nothing we do at all ever is going to change how that heel hits the ground. So those things are going to come back. They're going to try to come back. So if you have bunion surgery and you don't look at the biomechanics that caused the problem to begin with in the first place from your chiropodist, and didn't have a good assessment, then that bunion's going to come back and you're going to waste your time because you're going to have other troubles going to happen. And I've seen it over and over. Been in this industry for over 28 years. And let me tell you, I have hardly ever seen a bunion or a hammer toe that didn't try to come back and cause an effect somewhere else. And typically at that point, then we end up with wounds, because these people by that time, they have diabetes, they have circulatory problems, and then they have this structure of their foot that has been destroyed from surgery and also just from the body's normal compensatory action happening, causing, having to set up something somewhere else. So very delicate.
Yeah.
See your chiropodist before you decide on surgery.
Yeah, thank you. Thank you. So last question. Resilience is a topic that I love to talk about and that I think is so important for women's wellness. So what does becoming more resilient mean to you, and how does it relate to the women that you treat?
Me personally, I'm resilient. No matter what happens, I always find if there's something not good in life, well, I'm going to figure out a way to deal with it and see it in a positive way, how positive changes that I can do and that kind of thing. So I think just in everyday life, gather as much information as you can. Don't be afraid to make a decision. I think a lot of people sit and ponder on decisions, and you need to make a decision. Life is if it's not working, change it, right? So have a good look around what's not working in your life. And if it's your feet or anything else, then you need to figure it out. Don't let it sit. It's just going to cause something else. So resilience, I don't think resilience comes naturally to a lot of people, right? And I think some of us have to work on it a little bit harder than others. And but certainly I think as a practitioner like yourself, as a woman, we're here to help build confidence and encourage so we can be more resilient to change and do things. And just has to be the right guidance. And it has to suit everybody's lifestyle at some point, right? So I don't know, it's a very large area.
Absolutely. Well, thank you so much for sharing your insights on that question and all the wisdom and knowledge that you shared today. I have no doubt that women are going to greatly benefit from what you've shared. And thank you so much.
Thank you, Tara.